Okay, thank you, Jason.
Alrighty, we're ready.
All right. Well, good morning, Medical Club, or good afternoon, I guess. Hey, guys. My name is Robert Yount. I teach here at Northview High School, and I'm really happy to be here and be part of your experience. Should I? Oh, I'm sorry, Miss D. You guys want to ask questions, or should I just kind of tell my story, or am I using the handout you sent as like
Yeah,
guiding?
yeah. So the guide just kind of helps you to cover like the overarching aspects of what what would help inform them. They have questions along the way. They can certainly either type or talk. To ask you questions, but it's super informal and just however you want to present your story.
Oh, okay. Okay, great, great, great. Um, my name is Robert Yount. I am 48 years old. This year, going to turn 49 in October. Thank you. I do look young. I'm sorry. I'm a little nervous. I've been talking all day, and hey, James, and I feel like you guys get talked at all the time, right? So a little hesitant, a little apprehension. Um, let me get straight to it, I guess, right? Back around I want to say 2016, maybe 2015, I had an irritation pretty far down here in my throat. It felt like the beginning of a sore throat, and it just would not go away. And if I took a couple Tylenol, it would go away for a few hours and then come back. And so, before you know it, I'm eating, I don't know, 8 to 12 Tylenol a day, right? Like wake up, take a couple, oh, it's hurting again, I'll take a couple more. I guess the reason I went that route was because the pain wasn't unbearable. It just felt scratchy, right? Like the beginning of a sore throat. So, after a while of a daily menu of Tylenol, I went to the doctor, and I got referred to what's known as an ENT, ear, nose, and throat specialist. And he took a look. They run this thing. They call it a spaghetti or a noodle, and it's a very tiny with camera on the end, and they run it up your nose, and then it goes back down your throat, so they can take a really good look. And of course, he did other examinations, and he was very abrupt. He shoved it down. I'm sorry. Let me back up a little bit. I was obese, well over 300 pounds. And that can cause some discrimination, or maybe not discrimination is not the right word, some dismissiveness. And in my experience with my mother and my wife, women go through this at times with medical professionals as well, where you go in with an issue and they connected it to my weight, or for some women, they're just dismissive out of hand, right? Oh, you have a bad back. Oh, well, it's probably this. So what happened with me was the doctor came in the room and he commented on my weight right away before he even examined me. And he seemed irritated with me. And he put that thing in my nose very abruptly. It was painful. He shoved it down my throat. He told me that I had a little mucus buildup, and that it was likely from, I forget the word he used, but it's kind of like from mouth breathing and snoring at night. And it was all related back to my weight. And it was because I was overweight, I was experiencing this pain. And that options were a tonsillectomy, but that was dangerous because of my weight. There was something else, but that probably wouldn't work because of my weight. And I really left there feeling dejected. It was all about my weight. And so I went home, told my wife, had to prevent her from burning down his doctor's office, right? And I continued my daily diet of Tylenol. And that went on for a couple of years, just dealing with a sore throat and eating Tylenol every day, and beating myself up about my weight and trying different things to lose weight, thinking that this is all associated. Finally, I went back to my general practitioner, my family doctor, who I trusted, and I said, listen, this is not going away. I'm not buying this. She got me what's called a second opinion, a new referral. I went to that doctor. He put the spaghetti in my nose. I could not over exaggerate the difference here of the kindness. First of all, he put lubricant on it to make it go down easier. He explained to me why he was doing it and how it was going to feel and exactly what the process was, that it was going to go through my nose. It was going to tighten here. And if I breathed a certain way, it would go down easier. And he was so kind and compassionate. And he spotted, instead of down here in my throat, he spotted back here on the back of my tongue as you go down into my throat, he spotted a lesion, like a sore. And he said, oh, there it is. There it is. That is causing your pain in here. And the way he explained it, it's called referred pain. So because the ear, nose, and throat are all connected, you can have a pain in one and feel it somewhere else. And it's all the nerve endings where they connect. And he said the lesion on the back of my tongue was causing that irritation. And he wanted to cut it off my tongue and take a look at it. So that was 2018. And we scheduled the surgery, the biopsy. I think it was a spring break-ish of 2018. I went in on a Friday. He told me, the way I took it, I didn't have much to worry about, that he was going to cut it out and everything was going to be fine. But they would check it for problems. So did the surgery, woke up, extremely painful for recovery. I had trouble swallowing, right? So I was on a liquid diet for about a week. And that, like I told you earlier, that didn't hurt me. I had enough weight to hold me over for a little while. My wife was pretty nervous. She got a totally different vibe from the doctor than I did. But she was kind of holding that in. So 10 days, I think, goes by, and I go to his office to get the results, and he was not there. He had another doctor come in, and the doctor read off, blah, 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 carcinoma, blah, 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 blah. You have cancer. And I said, well, what do you mean? Wait, what do you mean? And he said, the lesion we took is cancerous. And usually what they do is they measure it, and that will help tell you what stage you're in, depending on the size. That's one criteria for staging. What I've learned is all of this is super complicated. If we don't have personal experience with it, it seems a lot more clear cut and black and white. Oh, you have cancer and here's a treatment, right? It's this kind. It's actually not quite like that. There is a lot of doubt and possibilities. Anyway, this doctor said that when they pulled the lesion and when they went to measure it, it fell apart. It like crumpled, and they weren't able to get an accurate measurement. But his best guess was stage 3, stage 1 being the lowest, and then 4 being the highest, meaning it's spreading. And he said, this is serious. I'm going to put in for emergency referral. And I said, for what? And he said, treatment. You need cancer treatment. You need radiation. You need chemotherapy. Like, you have to get on top of this. And so I went home and I talked to my wife, and she was kind of expecting it. And I was shocked. So it was really weird how we got different vibes from the doctor. And she said, I can't believe you thought everything was going to be fine. Didn't you hear him in the pre-operation room? And I said, yes. Didn't you hear him? Like, it was so funny. Anyway, I got my referral, and I went to an oncologist that does chemotherapy. I can't remember the name off the top of my head. Anyway, they're the ones that do chemotherapy, and chemotherapy is a medicine or a poison, right? And you put it in your body, and it kills your cells. And the idea here is that we're going to kill the cancer cells. And yes, your other cells are going to get killed too, but they will regenerate. And so it's going to be very painful. It's going to take, all your energy and so on and so on, side effects. But this doctor did not want to sign me up for chemotherapy. He said, listen, I think your ear, nose, and throat doctor, that's what they do. I'm an oncologist. I handle cancer. They did not get measurements on this lesion. I'm not convinced that you need chemotherapy. I said, oh, that's awesome. Thank you. And they said, okay, we're going to run a couple tests just in case. We need to make sure your kidneys function well, because if we do have to put you on chemotherapy, that can be an issue. We're going to do some blood work, but I don't think we're going anywhere with this. And I said, oh, great. Then I had, and so keep in mind, this is about 3 weeks to a month after my initial diagnosis. It's hard to get doctor's appointments, right? So first, the insurance company has to approve the new procedure or the new doctor, and then you have to find an appointment, right? So this was 3 weeks to a month. And I want to make a note here that how important support systems are. While I was here at work teaching and living with this stress and concern, worry, my wife is a bulldog on the phone, right, with the insurance company. Where's the referral? When's it coming, right? And she's making appointments with doctors for me. That's too far away. We need it now. Don't you understand, right? And so it was really helpful. Still took 3 to 4 weeks. And that's when I get to my radiologist, oncologist. So the two types of treatment or two of the types of treatment that are available, one is chemotherapy, and that's usually for, the way I was explained, like stage 1, we might be able to cut it out. Maybe we do chemo, maybe not. Stage 2, you should probably get chemo so we can kill these cells in your body, but probably you don't need radiation, which is burning the cancer out of your body with a machine, right? Stage 3, you probably need both. Stage 4, you should get both, right? And on and on. So I get to my radiologist, oncologist, the one who would do radiation. He looked at my paperwork and panicked. Complete opposite a reaction than the last doctor. And he said, you have 0 time to wait. And the way he explained the treatment to me, he said that he couldn't do it, that because it was in the neck and head, anything above the shoulders is kind of a different beast once you start dealing with this. And he was not qualified, in his opinion, to give me radiation in my throat. And he said that the way that it's done, it was something like brachia or anyway, he told me that I was going to check into USC Medical Center and they were going to implant 2 metal rods into my jaw, and that I was going to have to live there for 3 months while we did daily radiation treatments, because it is so dangerous to do radiation in the mouth or the head, I guess, and the throat, in this area, because of the side effects. And it has to be pinpointed. And so I left there. I remember throwing up when we left in the parking lot. I was shook. And so he said, I want you to get a second opinion. I'm going to put in a referral because I don't do this here. You need to see someone else. And my referral came in to another radiation oncologist, just like this guy. But this person worked for City of Hope, which is a pretty well-known hospital. They're pretty successful with cancer. And although it wasn't at the main office, it was what they call a satellite office in Pasadena. I was pretty excited because I know City of Hope, this is their area of expertise. I get out to see that doctor, and this was one of the more brilliant doctors I've seen, very straightforward, came across as if he understood completely what was going on. And what he said was, oh, you're going to be fine. You're going to be fine. You're going to need 6 to 7 weeks of simultaneous chemotherapy and radiation treatment, but there's a very high survival rate and you'll be fine. And I said, oh, that's good news. And he said, wait, it's going to be brutal. It is some of the most brutal cancer treatment out there, but you'll be fine in the long run. I said, okay, when do we start? And now we go back into this bureaucracy of insurance. Well, Mr. Yount, I can't see you here. You're out of my network. I am just a referral, and I will give my opinion to the insurance company. And I said, look, doc, you can't send me back to the last radiologist. He's talking about this brachytherapy and putting me in USC. Without hesitation, this doctor said, was he really old? And I said, well, yeah, he was. And he said, yeah, that's how we used to do it. But in the last 5 or 6 years, there's been a lot of advancements. You're going to be okay. And I said, great. Guys, it took 5 months for me to start treatment. But between my diagnosis and all the bureaucracy and all the confusion about my treatment, and so here's what it ended up. By the time I start treatment in September of 2018, after a diagnosis in April, I was stage 4 by this point. It had grown bigger. It had come back, grown bigger, and it had it did not come back. I'm sorry. It had spread to my lymph nodes, is kind of like in your chest area. And so the fact that it's spreading classifies it as a 4 now, and we got to do chemo and radiation. And because this doctor in Pasadena was so helpful, I was able to do radiation at a City of Hope affiliate. Like, they're tied into City of Hope, but they were in Glendale. So now September comes around and I am ready for treatment, and I'm going to be going to Glendale for my treatment. So I wanted to stop here and see if you guys had any questions, if I'm going too fast, if there was any confusion.
Did you have Kaiser or do you have your HMO? Or
I'm sorry. I had HMO. And guys, that means that instead of going to Kaiser, I have a limited number of doctors and hospitals I can go to that my insurance, Blue Shield, approves. And City of Hope was not in my network. Now, if I would have lived somewhere else, or, you know, they might have been in my network, but they were not. So it was kind of a special circumstance to get tied into City of Hope. But it's why I had to go to Glendale every day, which brought other challenges.
But if you had Kaiser, it would have been Kaiser's solely their network.
Yes, yeah, absolutely. All right, so I go see this radiologist in Glendale, Dr. Kozlowska, a very hard name to pronounce. He insists Dr. K, right? Dr. K. So I see Dr. K, and his staff is great, but they run down the treatment plan. They say, here it is. We're doing radiation on this area every day, every weekday for 7 weeks. So you got to drive out here every day for 7 weeks for a 20-minute zap. And I said, okay, I can do it. And he said, there's going to be 3 times in those 7 weeks where you're also going to be out here in Glendale for a full day getting chemotherapy at another hospital. And I said, okay, doc, I got it. And he said, okay, here's the deal. You got to go see an oncologist, cancer dentist. And what they're going to do is they're going to make a mouthpiece for you that you're going to have to wear while you get this treatment. And they have to see if you have any problematic teeth, because radiation in the mouth dries out the saliva glands and basically kills saliva. And that is what keeps cavities away. It helps you process food, and it creates oxygen for your teeth. Once your saliva glands are damaged or done, your teeth now are harder to work on. You can't just pull a tooth or get an implant. It is a huge process because all of your bone in here now lacks oxygen and is fragile. So I go see this dentist, and he does, his x-rays, and he said, okay, Mr. Yount, we're going to pull 9 teeth. I said, well, wait, I'm sorry, doc. What do you mean? I don't have 9 root canals. I don't have 9 cavities. And he said, yeah, but the 9 I've identified may be a problem in the future. So we got to take them now. And so that was on the menu. We got to pull 9 teeth. So it's all these down here in the front. And then some of you that I have in class, you've noticed I haven't been wearing I'm having trouble getting used to my piece that I put in my mouth. It makes me talk funny. It tastes funny. I got a couple gaps over here, but down here on the front, I have a bridge, a replacement of fake teeth that are permanent.
They literally did take out 9 teeth? Oh my gosh. I didn't know that.
It was pretty traumatizing. It was pretty traumatizing. But the other thing they did was they fit me with this mouthpiece. And so here's the deal with the mouthpiece. What it does is it's this clear plastic and you put it in your mouth. So here's radiation treatment for my situation. I would lay down on a table and I would put this mouthpiece in that cocks my mouth open wide. Ah! And it gags a little bit. And then I would have to lay down on a table with my hands under my butt, and I was not allowed to move because the radiation is targeting certain areas. And if you move, you got to start over. And so the other thing that they did was they shaped a plastic mesh. They take this flat plastic mesh and they heat it in water to make it formable. And then they molded it over my face. So when I went for treatment every day, what it was put my mouthpiece in, lay down on the metal table, and then they put the mesh over my face and bolt it to the table. So it was very torturous. So I was locked down on the table for 20 minutes. And then they would zap me. Once I started chemotherapy, I was extremely nauseous. I could not eat a thing. And so that would weaken me. And so going daily was a problem. But once the effects of the radiation started kicking in, what we're talking about is a burning inside. So when they're radiating a patient, you don't feel the burn. Like they're not torturing you, but it does burn the inside of your body, right? I got a couple of pictures I'll send you here in a second, Misty, if I find them. The other thing the radiation does besides burn you is before it dries out the saliva, it starts overproducing. So while I'm laying on the table, gagging on the mouthpiece, trying to disassociate for 20 minutes and not think about where I am, the saliva is dripping into my throat, right? And it makes me want to vomit and gag. But I got to hold it down, man. I got to deal. It was like going to torture every day. It was like going to torture. I actually thought on several occasions, this is an excellent way to torture people if we ever want to torture people. Like, so I would do that, and I would do chemotherapy, and I'm trying to think of other side effects, but I could not eat. Once the soreness started in my throat, mixed with the chemotherapy and the nausea, I couldn't eat and I couldn't drink. And so now we're starting to run into some problems, right? Because now I'm going days without eating. And when I say not eating, I don't mean like, oh, I ate a little bit. I mean, I cannot, anything I put in my stomach is coming right back up. And then I get to a point where I can't even swallow it because it hurts so bad. And by the way, one of the side effects, the type of chemotherapy I had was it takes away your taste, and then things taste like metal. So everything I did taste had kind of a metal taste. And Dan, our security guard, our campus security, had similar chemo, and it did the same thing to his taste. But the other thing the radiation did, besides kill my saliva, was kill my taste buds. So now, even if I wasn't nauseous, everything I put into my mouth at first tasted like metal. Then after a couple of weeks, it just starts tasting like sand. It just turns to mush in my mouth. So I stop eating, right? And now my wife is pretty concerned. So, and Misty, I sent you a picture of the, I don't know if it went through yet. We could show it later, but that is some of the effects on the outside, right? So I'm not eating. So we go see my doctor. We get another referral to a gastrointestinal doctor. And what we decide is to put a feeding tube in my stomach. So I go for a procedure. They cut a hole in my stomach. and they put a tube directly into my stomach. And now I have a tube hanging out of my stomach, a tube probably, you know, the diameter of a pencil, about a foot long, and it just kind of dangles from my stomach. And the idea here is that I get some type of protein shake, like Ensure, or my wife blend up some food, and we shoot it in there with a syringe, and I would eat that way. And so we tried that, and the very first time I threw up all the food, right? And so I stopped for and it was all like liquid, horrible stuff. We tried that a couple times, and I just could not keep up with the feeding tube. It just was not worth it, and there was no desire at all to use it. So we tell my doctor, and the doctor says, all right, well, listen, you're not eating, you're not drinking. That can only go on for so long. So we have to get fluids in you. We have to hydrate you. So what they did was they ordered a stent. So what that is I had basically a tube, like a permanent IV, put into my arm. So that means anywhere I went, somebody could plug an IV into me, right? Without going through the whole process. I already have the plug kind of sticking out. So I get this stent, and my healthcare insurance, this is where they did come through. They sent IV bags to my house, and my wife would plug it in, and I would get an IV once or twice a day to stay hydrated, and that allowed me not to eat without dying, right? And once a week, a nurse would come and clean the stent and make sure everything was going well. So I went a few weeks without eating anything, and of course the weight's just dropping off me. And it's at this point my wife wants to go back and burn down the other ENT doctor's office again. And she's come to the conclusion that without my obesity, I may have died, because at least I had some weight to lose. I had some weight in the bank, right? So I go a few weeks without eating, and then we try the food again through the tube. And this time, not only do I vomit, it comes back out of the hole in my stomach, and I get an infection from the tube. And then I call that doctor, and he's on vacation. He was not a very good doctor, right? And what I found is that, just like in teaching, Miss Jones, right? Some of us are professionals and some of us aren't, right? Some of us continue to do professional development and learn the new strategies, learn the new treatments. And some of us, you know, got paid time off, and we're going to use it, darn it, right? And so he was nowhere to be found. And anyway, so I stopped eating for a few more weeks, and got some antibiotics for that. And I believe that one of the things to keep an eye on with kidney function, kidney failure, kidney problems is, again, back to your ear. Your ear aches. One of the things that is developed first in the womb, when you're in your mother's womb, right, are ears and kidneys, and they're kind of connected together. So what happened was, after that infection, I got a really bad earache, and then my fever spiked to like 102. I think it affected my kidneys, but I don't know, because my wife and I were trying to hold out and not go to the emergency room, because in the emergency room there are diseases, viruses, and when you're in cancer treatment, your immune system is very low. And so we were saving emergency room for like death's doorstep, right? Or death's doorstep. So I powered through for a couple days. The fever broke, the earache went away, the infection went away, but I still just did not eat. And things just got worse from the side effects, from the radiation and the chemotherapy. And that was pretty much treatment. But what was interesting is how the side effects kind of caught up. Like, so the first week, there was really no side effects. Man, when I was done with radiation in November, the side effects of the burning and not being able to eat and not having saliva and not having taste buds lasted for months, right? So I thought I was coming back as soon as treatment was over, first semester. But the truth was, I could barely stand up. I was so weak from not eating, not drinking, not exercising. I mean, I was about 22 hours a day laying in bed suffering, right? So after the chemotherapy is done, after the radiation is done, you know, it's December, it's January, and now I'm trying to force myself to eat because I got to get used to it again. So nothing had taste, and I took very small bites. And anyway, my diet has changed drastically because without the saliva, I have trouble masticating, chewing, and breaking down food. So like animal meat products, they do not break down very well. Like if I eat chicken, it will just chew and chew and chew and chew. So even still to this day, anything I eat usually has to be swallowed with water, right? Like I take a bite of something, I chew, 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 and then I have to wash it down. Every once in a while, I can swallow something without washing it down, and I'm surprised. Like, hey, because I have scar tissue. It's just all scarred up in my throat, right? So food gets stuck in there. I take a vitamin every morning. Sometimes I swallow it. 15 minutes later, I'll be driving to work and I'll cough and it'll come spitting out. It's really disgusting, guys. I get a lot of, you know, a lot of spitting. Thank God my wife is understanding. It's embarrassing and in public too. But I've gotten more cautious, right, and better at handling it. But those were some of the long-term side effects. I lost about 130 pounds. When I came back at showcase night that April, people didn't recognize me. I quite literally look very different from the weight. My diet's very different. I would say I'm about 95% vegetarian. I still like fish and sushi. I don't have a problem breaking down fish. It's okay. And I'm about 90% vegan just because I kind of had a restart, and I'm able to eat a lot of plant-based stuff. Veggies break down. They're all water-based, right? Like, so I made the kids pasta last night, chicken Parmesan, right? This fake chicken, vegetarian chicken, right? Processed with some pasta and red sauce. Well, I took some of the pasta and then I cooked a bunch of bell peppers, onions, and mushrooms to throw over it, because now it's a water-based meal and I'll be able to chew it more easily, right? And slide it down. So that's a lot of the fun, like gruesome stuff, right, to tell. But I want to put an emphasis on that support. I want to circle back to that because this is what the doctor told me. When that one doctor in Pasadena said, hey, you're going to be fine, but the treatment's brutal, but you're going to be fine. Here's what he said. He said 70% success rate with this treatment. And I've thought a lot about this. Who are those other 3 people? If 7 out of 10 people beat what I had, who are those other 3? Because I had it pretty bad because of that lapse. It got to stage 4. And what I've determined was my treatment would have been delayed longer without the support of my wife. My resources, my privilege of my job and my insurance and my income allowed me to have good medical treatment. And when I didn't get good medical treatment, I could force a different doctor. Not everyone has that. My wife was able to put me in a car every day and drive me to Glendale and back every day. And those days I had chemotherapy, we were out there all day. That takes resources. I could not have gotten on a bus and done that for 7 weeks. I know I would have failed. My wife was helping me put on my socks every morning, right? So, and then the Northview family, the teachers, the staff, the community. My sister-in-law, without talking to us, I was embarrassed she did this, but she put up a GoFundMe, and she didn't realize what that was going to do with this community. And this community came out big for me. And all of a sudden, my bank was swollen a little bit. Right. And now people are showing up at my house, former students, staff, right? Miss Woods here put together something that you guys, I have a handout if anybody's ever thinking about it. It's called Meal Train. And so what people did was they signed up online a couple nights a week to bring meals to my house. Now, of course, I'm not eating, but here's what some of you may not realize about making a meal. It's you got to plan it. You got to go to the grocery store and get it. You got to cook it, and then you got to clean it up. And guys, that is ours. That is ours. And my wife doesn't have it because we're in Glendale every day. And she's raising the kids by herself now too. And she's doing the chores by herself now too. And she's my advocate, calling insurance companies, calling doctors, getting my prescriptions, telling the nurses. I can't communicate. I'm burned out. I can't talk at that point. She's doing everything. She doesn't have time to throw together. My kids were eating cereal, sandwiches, fast food, right? Which isn't bad if you're in a tough situation, but not ideal, right? So all of a sudden, twice a week, I got teachers, alumni, people showing up to my house with meals. I mean, people fed my family when I could not, you know? So looking back on it, that 70% survival rate, I believe that is people, it's not a matter of I kicked cancer's butt, because that's what everybody likes to say. You're going to kick cancer's butt. Oh, you kicked cancer's. Oh, you really fought. That's the opposite of what I did, actually. And maybe it's different for everyone. I completely surrendered. And I said, I told myself, whatever the doctor says to do, I'm going to do. Whatever my wife says to do, I'm just going to do it. I'm going to go no questions asked here. So I actually didn't fight. I laid in bed, and when somebody would show up on my bedside and say, hey, we have to do this now, I would say, and then I would do that. So when I look back at that 7 out of 10 survival rate, I do not think the other 3 people didn't fight hard enough or couldn't kick cancer's butt. I think they likely didn't have insurance, financial support, emotional support, right? Jason, thank you. Thank you. I thank you. I would not be here without Northview too. So, I mean, that's just how that is. The support that came from this place was just ridiculous. And still, I mean, asking me to share my story, right? So anyway, I had a ton of support, and my family was great. I think it hit my 5-year-old the hardest. The instability of it all, kids need stability. He's still a little bit of a problem for us. He likes the fire. He likes the chaos, right? He likes to challenge us all the time. And I think he's a little addicted to all that chaos we had, you know, for 6 months. Let me see. Anyway, so I ended treatment in that November of 2018. In December, I had a full body scan and I was cancer free. And then they've done and then they've done a few more of those. So right now, I see my doctor and my oncologist every 6 months. And he'll go in with the spaghetti and he'll do a physical, and then he'll check me. Like, so right now, what him and I, Dr. K and I are doing is my thyroid, the thing that regulates your metabolism and your weight. Well, it got zapped. And so it's not functioning very well, right? My metabolism's a little low. So he put me on some medication to get that going. And I just took blood this week, and I'll have to meet with him sometime soon to see how that's going, if we need to increase or decrease. Other than that, my long-term side effects, little PTSD. Sometimes I hear or smell or think about certain things, and I get sick to my stomach and kind of get a little chill. My teeth are an issue and are still an issue. My mouth is constantly dry. It's like having cotton mouth all day long. So you'll always see me with a couple waters. And at night, I use fluoride. I put in these teeth trays, and I have to put them on my teeth for a few minutes at night to soak them in fluoride. And that helps with my mouth not drying out overnight. And it keeps my mouth, not saliva, but, you know, like wet, right? And in the morning, I brush all that out. Some positive long-term side effects would be my new diet, and I'm really happy with the way I'm eating right now and my exercise. Although COVID's gotten in the way of exercise a little bit, I'm really happy with the fitness lifestyle I've adopted, and my cooking. It's more of my hobby now to cook new things. Last week I had Brussels sprouts with maple syrup and sriracha on them, right? And some. My taste is back. My taste came back. Yeah, about 90% to 100 in there somewhere. So my taste is back. And then I am committed to giving back to this community. I look at my job a completely different way. I've always liked it. I've always seen my job as one of service, but now I'm kind of like always on the lookout to help and give back because this community did so much for me. And then I guess one thing, this really bothered me when I was sick. People would tell me, listen, when this is over, you are going to have new perspective. You are going to have new gratitude, new appreciation. You're going to be a whole new person. It's going to be really good. And it used to really frustrate me. Like, hey, I'm not a movie. I'm not a cliche. I'm not here to forward some feel-good story for you. I am in misery right now. I can't eat. What are you talking about? They were right. They were right. I don't know. There's just not very much that bothers me anymore. I just have a different approach to life in general. So there are definitely good and bad long-term effects from that experience. And the other thing that really shook me while I was going through that experience is, and this is true with COVID for me now too, going through one bad thing does not exclude other bad things from happening to you.
Right.
So I was hyper aware when I'm lying in bed 20 hours a day. Every time my wife left the house, I was hyper aware that she could get in a car accident. Mm-hmm. Right? I was hyper aware, well, not even aware, paranoid, because I had nothing else to keep my mind busy. I would lay in bed at night worrying that our house would catch on fire, because some people have house fires for very little reason, and that could also happen, right? And so I was very paranoid the whole time, waiting for something else to happen, because I was fully aware this wasn't a pass. Like, I didn't get to say, oh, sorry, we can't have a house fire, I have cancer, right? Very much like that with COVID, that while all this is going on, it does not prevent other horrible things from happening, and we got to be really cautious and aware of that. I think I am. I try, and stay grateful. Yeah. I think that's it.
Guys, a couple of things when we did have that back to school night. And I remember I didn't know you were there, but between all of our staff, it was like, did you know that Yount was here? And we're like, where is he? Where is he? That's him. Like he was saying, he was so thin. And he had just looked like he had been through the ringer. And I'm like, I mean, I remember seeing you clearly and thinking, oh my gosh, that's him. Like he's here, because he had been gone for quite a while. And, grateful to see him. I'm going to cry.
Yeah, it was really emotional. Yeah, it was good to see you too, Misty. It was pretty emotional. And I remember seeing Manny first, and him and I walked up to Miss Martirosian's, and she thought Dr. Burciago was introducing her to somebody new. Like, she said, hi, my name is Miss Martirosian. It's nice to meet you. I said, I'm Mr. Yount. She said, wait, what? I mean, it was a complete different look. It was something else, guys. It was something else. It was something else.
But you're back to your old self in a good way.
I think so. Yeah, I definitely have some issues eating and tasting, and the dry mouth, and I'm gonna have dental issues until it's all over. But I do feel back. I remember when I started parenting again. You know what I mean? Like, I was pretty much out of it. And there was this one time in November when I was in the thick of treatment, and I was sitting in the living room in a chair I was trying to come out and be with the family. And I was sitting there kind of hunched over. I could barely you know, and I was on lots of narcotics, you know, and I was just sitting there, and my 5-year-old was running from my wife. Right? She was like, "You better come here! Stop running from me!" And he's screaming, "Ah!" And he's running from her, right? And my first parenting move in a couple months, I just stuck my foot out and tripped him. And I thought, oh my good, that's the most I've parented. Like I can't. And so when the calendar turned, you know, and before I came back to work in April of 2019, I was able to start doing things, making a meal, getting them dressed. Right? So every day was practice. Like, hey, I gotta get ready to go back to work. I gotta, you know, showers took 20 minutes instead of 8 or 9 now. Everything was harder, but I do feel like I have my energy back, and yeah, I'm feeling pretty good.
So as a couple things. So as far as your like salivary glands, will those recover or heal, or is that something you have to deal with for life? And then what do they say about prognosis of cancer being gone for good?
Oh, thanks for asking. So yeah, the dry mouth is something I will deal with for forever. And it's not as bad as it was. I've been pretty diligent about my nightly treatments and about trying new foods, and like I'm pushing myself, right? But I think it's as good as it's going to get. And then the doctor said, excuse me, the doctor said a 90% chance. There's only a 10% chance of a return. And I said, well, 10%'s a lot. And he said, yeah, we all got a 10% chance though. Like everybody walking around has a chance to get cancer. Like 90%'s good. Get out of here. Like go be happy, you know? And so I feel pretty good. I feel pretty good.
Good. Yeah, that's a crazy story.
Yeah, it was fun telling it. It was kind of cathartic. Let me see. I can if I can. No, it's not letting me send this picture to you, but I'll try to.
I'll send you my personal email, and it probably will. Maybe is it?
No, it's too big of a file.
Oh.
So here's what it did to the outside. Let me see if.
Oh yeah. So it like burned your skin.
Yeah.
Wow.
And so that's more of an effect of what's happening on the inside. Like the radiation doesn't exactly burn when you're doing it. It's burning the inside though. It's like a sunburn on the inside. And then it manifested out there, sure. But again, I would come home from treatment and my wife would rub me down with aloe vera and put in my IV, and not everyone has that type of support. If I was home alone, I would still be scarred from those burns if I was even able to finish, right? Yeah,
that's a lot of insight with, I mean, you guys probably don't think about insurance or all that stuff, but those pieces, like if I ever got cancer, I'm coming to you and Dan to like, what do I do?
Yeah.
What's the ropes? Because, you know, just that piece of navigating the insurance part, like you're saying, go to all these different people, that's a time waster if you don't really know the ropes of what to do and how to navigate all that.
Yeah, that's a perfect example. So here you go. When I go see a doctor and they need to refer me out to treatment, they have to get authorization from the insurance company, who will mail me a code, right? So I would go to the doctor on Monday, and then maybe a week later, I would get an authorization code in the mail. But instead, what happened is I would go to the doctor on Monday, and then Tuesday, my wife would call the insurance company and say, what's his authorization number? And they said, well, we don't have it yet. And she would say, well, get it. This is an emergency. It's already been this long. And then she would get it, and she would call and make an appointment for me. And they would say, we don't have the authorization yet from the insurance. And she would say, here's the number, right? I have the authorization number. And they would still say, okay, we have an appointment in 2.5 weeks, right? And so, right, it's without that, I just don't know what I would have done.
Yeah, that's crazy. That's crazy.
Well, thank you, Jason, for inviting me. You asked me about this a long time ago, and this did feel good, guys, to kind of talk it through. And thank you, Ms. D, for having me, and more importantly, for running this medical club. I've ran a couple clubs in my day, and it was definitely off the table for this year. There was no way I was doing anything extra right? And so I really appreciate you giving these students an opportunity to get into their hobbies, explore things they might be interested in, and get some firsthand accounts from people. And I've seen some of your other guest speakers. My son did your CPR training. This is a valuable club, and I really appreciate you doing it.
We've tried to keep it going. It's been hard, but we've been able to keep it going with speakers. And so your son may want to know, we're bringing CPR back. We got the okay to do it. So we'll be advertising that very shortly.
Okay, last funny story, guys. I'll let them know. So funny story to close you guys out. I knew I was walking around with a cancer card, right? Like at any point, I could, you get pulled over for a speeding ticket. Do you know why I pulled you over? Is it because you wanted to help me with my cancer, right? Like I felt like I had this card to play and get some sympathy. So I always had that like in the back of my mind, right? And my teenage son, who's a Viking, is a sophomore now. He was in middle school and he was not doing well in school. And so I talked to him. This is when I was recovering a little bit better, and I was able to talk second semester and say, hey, you're not doing well in school, blah, blah, blah. This kid looked me dead in my eyes and said, my dad has cancer. And he played the cancer card on me to get out of being in trouble for some dipping grades. But he pulled them back up, and now he's here with us at a better school anyway. But I thought that was pretty funny.
Yeah. No, he's got your wit.
Does he? Oh, poor kid.
No, that's a good thing.
Thank you, Misty.
No, Mr. Yount is always a senior vote for a favorite teacher. He has been for many years. He's a great teacher. If you haven't had the opportunity to have him, take him. You will come out a better person for having him.
Thank you, Misty. It's really kind of you to say. I really appreciate it. All right, we have a question and answer thing to go to if you're interested. Are you going?
Yeah, I am, because I had my kids ask me questions today when I was talking about it, and I told them, well, this is what I know. I'll tell you if I learn anything else. So yeah, we're going to a meeting, guys, about going back to school in April. So thank you very much for being here. I appreciate it.
Yeah, thank you, guys.
We're going to close out. Jason, I'll leave it if you want to. I'm going to go. If you want to stay and talk to them, Jason.
I'm going to go, yeah. Thank you, guys. Bye-bye.
Thank you, Mr. Yount.
Hey guys, before you guys go, I just wanted to let you guys know that we have our cups and masks finish, and Thursday and Friday from 1:30 to 3, we will be handing them out, me and Cabinet. And I will push out the list of names of the people who are gonna get cups and masks. But if you're not on the list, I believe there was a few names that got deleted, so send us a remind and then we can fix that for you guys. But if you guys don't make the list, you guys can always buy cups and masks, and we'll have prices, or I'll push the prices out later. How you did the list? Oh, I did the list by 50% attendance to our meetings. So I just got the people that were here at least half of the time, or at least half the year, and we did it that way. But I'll push out more information through Remind. So yeah, you guys are dismissed. Thank you.